Assalamu alaikum wa rahmatullahi wa barakatuhu. Our esteemed viewer at MTF for Africa. Once again, it's your program, the most cherished one, Health Check, a program where we give you medical advice, where we bring experts in different expertise or fields. Today, the topic of discussion is about cataracts, and this means that we're going to have our guests as an ophthalmologist. And that is none other than Dr. Herbert from Mbale. He traveled once again 300 kilometers to come and give us a hint regarding these cataracts. You're most welcome, Doctor.
Thank you so much, sir.
Today's topic of discussion is
cataracts.
Cataracts.
Yes.
We have discussed this topic several times, and to the viewers' request, we had to repeat it.
Yes.
The good thing, you are at the forefront when it comes to fighting these cataracts.
That's right.
So we have even some footage of you attending to some patients with these cataract ailments. And later on, we shall show you what this doctor has done in as far as treating such ailments is concerned. Doctor, first and foremost,
yes,
I might know what a cataract is,
yes,
but our viewer there, a layman who is joining us today, needs to know a little bit more about these cataracts. What are they?
That's right. Thank you so much for joining us, our dear viewers. As you've heard, our topic today is cataracts, and cataracts is basically the opacification of the natural lens inside our eyes that enables us to see clearly. Yeah, so in our eyes we have a part called the lens, and that lens is responsible for giving us clarity of vision. Yeah, so opacification of this lens causes you to have the condition called cataract. In that regard, you will not be able to see clearly.
Yes. Okay. At this moment, I'm going to request my producer. You know, I'm not always alone. I have a few people there in the background who make this, I think, even look a bit more interesting. We have some footage of some people giving us some information of how they were when they had these cataracts and how they are now, or yes, giving us testimonies that these cataracts can be cured. And to good information, you are the doctor, or among the doctors that saved these people. Let's have a look at the story of these people, and then we continue with our program.
Imonino bapira kwijenja Nairo hospital bangona kuimoni igumkono mulai ya tamandwena so that inyangino nakase kolete imona nakasa kolate ati imona busa rufumbe ketu sayo kifana eky'omuntu da
kata nabone ndese eriko kumonino nayega nakujisingamo kata nebone ngana weze mbale kumande oza mudikini.
Okay.
Sawa zidatunga wada.
Okay.
Mbale mu main hospital kuza kurongosa free charge.
Okay.
Weza ko ni mujanjabi
unyalani
ebitu bye kukozesako
ngona yo
gona yo chi
runa kulugenda
nalonyene
nanga kende naye sende numukaire kuli babiri fenye
yezani mukade
ingoko naleka yonana
mwigale mutakufu mutakoze kufu izinjege.
Well, that is a brief story of our friends who managed to fight this ailment. Doctor, what really causes cataracts?
Yes, and first and foremost, cataracts is a condition that causes blindness, but this blindness is avoidable. In our African population, Africa has a population of about 1.5 billion people, and out of this population, about 1.2% of this population is blind. And one of the leading causes of their blindness is cataracts. And these cataracts cause avoidable blindness, in that if this patient or this person who is suffering with cataracts and is blind due to cataracts can be operated. And once they are operated, they can recover their sight. That's why it is avoidable blindness. Yeah, so 36% of the blindness is caused by these cataracts here in Africa, yes. That is a very big number. Now, some of the causes are really the very common causes like age. Yeah, the most common cause or risk factor to this disease is the age.
Okay.
Once you grow elderly, 50 years going up, you are likely to get the cataract.
So the older you grow, the higher the chances of...
Yes, of having a cataract.
Okay.
Yes, that's one. Others, other causes, we have metabolic disorders like diabetes mellitus.
So before you go to the other causes, how can one fight age?
Okay.
I mean, that's what we are pursuing, all of us. We need to grow older. But
so we cannot stop aging. We have to age, but there are certain things that you can do to reduce the extent, the chances of you getting the cataract, or maybe to get it later in life, even as you grow older.
Okay.
You get it a bit later than you would have got it sooner.
Okay.
Those are some of the lifestyle modifications that we always talk about: exercising, having a good diet, eating a balanced diet.
What is the best diet for someone that wants to avoid having a cataract?
Now, there are some things that I would just ask people to avoid.
Okay.
Yeah, like too much oils, junk foods, smoking, alcoholism. Those are things to stop, because they cause a lot of oxidation in the body and end up causing cataracts, which can come earlier than it would have happened. Yeah, so if we maintain a good diet without some of those things, you can prevent yourself from getting the cataract early, even as you grow older. Okay. So of course, we can also have very serious nutrients that you can have in your diet that can help you, like vegetables rich in vitamin E and vitamin C and vitamin D, fruits. That should be part of your diet. Okay. Yes.
So
maintain
briefly,
a healthy diet.
Our viewer, this is what I would like you to understand. You can't avoid aging, because that's what you want. We are fighting to grow older. No one wants to die tomorrow. No one wants to die next year. That's right. But doctor has given us the advice on how to live aged, but still the cataracts can be avoidable. Look at your balanced diet, do exercises. So aging, that's one of the causes.
Yes.
Now let's go to another
causes.
Yes.
So other causes are other diseases, what we have called metabolic disorders like diabetes mellitus. Okay. The diabetic people have a higher risk of getting these cataracts because of that medical condition called diabetes. Okay. Yes. Other causes are long use of certain drugs. Some people take certain drugs for a long time, like steroids, corticosteroids, drugs such as dexamethasone, prednisolone. It's not good to take them for a long time, and you should only take them under prescription of a doctor. Okay. Yes. So if you overuse such drugs, you can also predispose yourself to getting cataracts. Trauma cases is another cause. Okay. Road traffic accidents, you get an injury to your eye, it can cause you to get a cataract. Okay. Other injuries, which may not be road traffic accidents, chemical injuries, injuries which you get when you're playing your games, injuries which you get when you're at your workplaces. So some of those are the causes of cataracts. Okay. Yes.
Thank you so much, Doctor. We have seen stories of vision restored earlier on, like I requested my producer to show us, and we have seen that. And right now, I would like our producer again to show us some emotional moments where these people, what happens to them? Yes. What happened before?
5 years of blindness.
5 years of blindness.
Now you can see.
Now you can see. After that emotional feelings is what I want our viewer to see and have a look at, and then we come back. Let's have a look at it.
Mama tunamutekamu. Mama kabateekemu eddagala. Tebanateekamu ddagala mu maaso.
We are very strong. I can see now my sight is back. Thank you, humanity first.
Okay, thank you so much. Those are the emotional moments. You have seen people living 5 years without seeing, almost having no hope of regaining sight again. But now a miracle comes to them. people have different myths regarding this cataract disease,
Yes.
and they were proven wrong.
Yes.
They regained their sight again. Doctor, now I want to take you to the treatment. How do you
Yes.
treat these cataracts?
Yes.
When it
thank
comes
you
to surgeries or at any other stage, you know better.
Yeah, thank you very much. Since we already defined what a cataract is, the opacification of the natural lens that causes visual impairment.
Yes.
Now, the treatment is basically one treatment, and that is surgery.
Sure.
There is no other treatment for cataracts other than the cataract
No
surgery.
tablets that I can take.
No eye drops, no tablets, no other thing, no washing of eyes, as people say. No, it's not possible. The only treatment for cataract is cataract surgery.
Okay.
Yes. So we always have challenges with this treatment because many people reject the treatment. Even when they are blind, they say, I don't want to be operated. I don't want, because they've had probably stories and myths, misconceptions about the surgery. They say when they operate your eyes, you will become blind. But we have just seen a testimony of a person who was blind for many years, operated, and now they can see.
Well, now they're
So
happy again.
the surgery is not a dangerous surgery. It is actually a life-saving surgery, a sight-saving surgery. So instead of fearing the surgery, we should talk to our people, go outside and create more awareness and tell them it is okay to have cataract surgery when you have a cataract, because you'll surely regain your sight.
Okay.
Yes.
Thank you so much. We are almost coming to a close, but before we do so,
Yes.
in Africa, we have a tendency of self-medication and self-treatment. What advice do you have for such people?
Yes. Most times when you go to the doctor early, you can be treated early before certain complications set in of your disease.
Okay.
So the challenge is that we go late after trying out traditional medicine, trying out, we go and self-medicate and do lots of things. And we come back to by the time we come to the doctor, you come much later when the disease has become even more complicated. So it is very, very advisable. Before you think of doing that, first find a doctor, have yourself checked, and have a right prescription from a doctor before you can self-medicate or before you can get any medicine. Yes, it is important, very, very important. Just like I said, some of the side effects of certain drugs can cause very bad complications, like long use of the corticosteroids, drugs like prednisolone, dexamethasone, can cause you cataracts actually. So some people are self-medicating probably because of an allergy. They keep swallowing them, and later on, at a younger age, they should have not got a cataract, but they get it because of such.
When do I have to rush to the doctor? By this I mean, when can one realize that at any time, sooner, he might attract a cataract?
Yes. Now, about visiting a doctor or having your eyes checked, it is something that should be routine. You should have it in your mind that at least every year, have your eyes checked twice.
Okay.
That shouldn't hurt.
So often, at least after 6 months,
Every 6
you
months,
go and see
have your
an
eyes checked.
ophthalmologist. How do you call it?
An ophthalmologist.
Ophthalmologist.
Yes.
Okay.
Because there are certain diseases of the eyes that will not show any symptoms, but they'll be progressing slowly. Some of those are cataracts. No pain, no what, but vision is reducing slowly. So you can only realize this when you go for an eye test.
Okay.
Diseases like glaucoma, it will progress slowly without causing any itching or pain or redness to your eyes, but after it can cause permanent blindness if you don't get help early.
Thank you so much.
But there are some barriers again that we keep getting. You know, we don't have very many facilities that are offering these services.
100% right?
Yes. So it's one of the barriers that probably why our people are not getting help.
Exactly.
That 36% of the population blind due to cataracts is a very big population.
Okay.
Yeah, so the infrastructure, the facilities, but also the professionals, they're not very many. So that
So
also
with such barriers, what advice do you
Yes.
give to
So the
people
advice
that
would
face
be,
such?
just like Humanity First gave us a wonderful time in Mbale, in Uganda, Eastern Uganda, and we operated over 300 cataracts.
Okay.
They were providing the funding, paying the doctors, and finding the patients wherever they are in their villages. You see, that is a life-saving thing because many of them are in their villages with blindness for many years, and they are not aware even of
So
what,
in this case, I think, or in this regard, I think the advice would be that whenever our viewer, you hear of any call for assistance that you are going to be helped in such and such a healthy field,
Yes.
please rush to those medical camps. You never know. You
Yes.
might meet miracles there.
That's right.
Okay. Unfortunately, we are not good friends with time. We have tried as much as we can, but maybe at some time in the future we might have a good relationship, but as of now time is kicking us out and we can't go against its rules, so we have to sign out at this very juncture. But the good news is that we have some more inspirational or faith inspiring programs that are coming in, and Health Check will still come again next time, same day, same time. Just stay tuned in MTA Africa, inshallah, and we'll get you covered. I remain your host, Namba Ali Bashir. Wassalamu alaikum wa rahmatullahi wa barakatuh.